We are here today to report that Ottawa Public Health has received notification of Ottawa's first confirmed case of the novel coronavirus. Nous sommes ici aujourd'hui pour annoncer que Santé publique Ottawa a reçu la notification du premier cas confirmé du nouveau coronavirus COVID-19. The individual is a male in his 40s and a resident of Ottawa who recently returned from travel to Austria. The individual is currently in self-isolation at home and has mild symptoms. The individual was asymptomatic during the flights to Ottawa, and he presented to the Ottawa Hospital emergency room after experiencing symptoms. The individual has been conscientious about his self-isolation, and he's been accepting guidance from Ottawa Public Health. Today, Ottawa Public Health was notified of a positive result. So Ottawa Public Health is following up with a small number of close contacts as part of our ongoing case management investigation. It is always important to remind residents to continue to follow normal precautions to help stop the spread of germs. So wash your hands with soap and water or use hand sanitizer. Avoid touching your eyes, nose, and mouth unless you've just cleaned your hands. Cover your cough and your sneeze with a tissue or into your arm, not your hand. If possible, stay home when you're sick. Avoid visiting people in hospitals or long-term care homes if you are sick. And finally, it is not too late to get your flu shot if you call your family physician's office to see if they still have some, or a pharmacy. Ottawa Public Health has been active in enhanced operations since January, and we're working to ensure that we have the processes and structure in place to adequately respond to the COVID-19 situation. This work does not change with our first positive case. We've been treating this as a pandemic and supporting residents and partners to prepare for escalating circumstances. We've been consistently working to actively detect the virus in travelers while enhancing our surveillance activities, which includes testing for people who have not traveled, where there's severe respiratory illness. We've been answering questions from the public and healthcare providers to help assess whether and when testing is needed, and we've been facilitating that testing in emergency rooms. We're continuing to create special teams within our organization and regionally, while reassigning staff to respond to the emerging demands. We have a special website for residents and one specifically for healthcare providers. We've been supporting community agencies and workplaces, employers in our community to ensure consistent communications to help residents prepare for a pandemic. As the situation evolves, we'll continue to work closely with local hospitals, health system partners, the Ministry of Health, Public Health Ontario, and national partners to support our community. I would like to assure residents that as a system, we're prepared to respond to this case and to continue to support our community in monitoring, detecting, and containing this virus. This includes working with our healthcare system partners to implement COVID-19 community assessment centers. So this will be a new service available in our community within a week to increase capacity for testing for the virus outside of hospitals. I would like to remind residents just how important it is that we continue to support each other in our community through this situation. I know anxiety levels can be high, and we need to help each other with seeking accurate information. Therefore, please continue to visit ottawapublichealth.ca/coronavirus. I just want to perhaps conclude by saying that the public health approach continues with the same objective as before the confirmation of this first positive case. We are looking to detect every case that is a result of travel into Ottawa. So we are asking people who travel outside of the country to monitor for symptoms when they return, to call public health if they develop symptoms, and we are increasing our capacity for the testing that would then potentially be required to rule out the coronavirus. And so I'm very thankful for the partnership with the city that's making facilities available. I'm very thankful to the Ottawa Hospital for their leadership around the healthcare capacity in our community and our region. And I'm very thankful to the media for helping to get the messages out. People definitely are concerned about the situation, and it's important to keep reminding people that there are things they can do to protect themselves. It actually really does work to keep your distance from ill people and to wash your hands and to avoid touching your face if your hands aren't clean. So thank you very much.